Hi, how are you? This is Dr. Farley. I'm going to be going over with you today about your root functional cause diagnosis sheet. So that's basically going back to this little flip chart here where we talk about the three big systems, the nervous system, the endocrine system, the immune system, and then the root foundational causes. I developed this picture, about 3 years ago in a seminar. I used to just draw arrows, and then I started to realize that gears make more sense because gears let you understand and you visualize that everything impacts everything. And really our physiology is a web of information and gears, and everything influences everything else. So there's no one isolated island of an issue like a thyroid issue or a weak brain or just a weak gut. We have to consider how everything interacts and influences everything else. So when I give you my diagnosis, it's based on proper testing, which we measure function. Then we identify from that testing, and our testing that we do is the NSI, ANS testing, your expanded panel, your specialty panel, any other blood tests or saliva tests we may have done, and then any follow-up tests that we've done. I may also look at any other diagnostic tests or things that you brought into me. And then when we're all said and done, we're giving you a physiological diagnosis. It means what is not functioning properly. Health is function. Health is not symptom management. So when we understand function in gears, we then can understand by proper testing, we get a proper diagnosis, which gears are off, and then a proper treatment plan. So I joke around, and in the front of my office, I just put down a sign that says, this is not Walmart healthcare. And what I mean by that is, we have to stop going in with our insurance cards and saying, hey, is this covered, is it not covered? And if it's not covered, I'm not going to do it. It's really a ridiculous concept because Walmart healthcare is exactly that. We give you a name, Parkinson's, thyroid, depression, anxiety, insomnia, irritable bowel syndrome, constipation. We don't look at why the body's doing that. So the symptoms are nothing more than the body telling you that it is not functioning properly. But we need to go down below to look at what's creating the imbalance. And there's usually, when I'm all done, there's usually between 5 and 20 gears all off on chronic patients. And most of you that are coming in are chronic patients. So the next sheet that I'm going to give you over time too, it'll be different looking than this because I'm creating a new one right now. But you're going to have a list of all the different things that we found wrong. And again, when this is all said and done, it could be 5 to 20 gears all off at the same time frame. The new sheet that you're going to get is going to be based off of this here specifically. And it's going to be laid out that says these are nervous system root functional gear problems that we found wrong. These are endocrine system. These are immune system. And then there's the foundational. The foundational means that they're really, really important and they kind of can impact everything. So from there, we'll go over this sheet with you and we'll give you what my diagnosis is. And my diagnosis is, again, physiology-based. It's not medically based at all. We're treating dis-ease, lack of normal function, and your medical doctor is treating disease, which is nothing more than a name for a collection of your symptoms. Most of the testing that's being done is very shoddy, not very thorough at all. So our testing is very good. We can measure you in the beginning. We can provide a treatment. We can go back in again and look to see what's changed, and we can modify what needs to be done over a time frame. Some of you will need to be a patient of mine for a short time frame, 3 to 6 months. And some of you, I'm going to recommend that you're a patient of mine until I die or you die, because that's just the reality of it. There's so many things going on that you're going to need someone to constantly keep track of where you were and where you are and what needs to change and shift over time. So hopefully you enjoyed this video. I think my shirt tie combo is a little bit wild today as I look at it. But anyway, you'll get a clean sheet with this. It'll be highlighted with all your root functional causes, and then you'll have that for your records. And over time, we want to see that you get less of these gears. Some of them go away completely, other ones hanging around, but they're still getting better. But most importantly to understand is this: health is how you function. not how you feel. And by measuring function, we can tell you whether you're moving in the right direction or not, and how good that is on what, and also to what level. So thank you and have a great day.